The most common cause of shoulder pain that we see is impingement syndrome, which is actually not one specific diagnosis. It's a variety of different things can cause the same kind of symptoms. And that's usually pain in this deltoid region around the muscle here, sometimes radiating down towards the arm or up towards the neck. And that can be brought on by movement, by lying on one side or the other, by remaining still, or sometimes just with certain activities. And picking out exactly what causes that pain is the difficult bits, and that's what the history and the examination help with. But it's often caused by problems with the rotator cuff, which is a series of muscles around the shoulder which give it its stability. And there can be inflammation around those muscles which give pain, but the muscles themselves can also be damaged, torn, or just sort of unhappy. The tendons are not what they once used to be. They are inflamed, thickened, and that leads to pain. Another condition which is typically quite easy to pick up because of its unique presentation is frozen shoulder. Now that can come on out of the blue, or it can be associated with diabetes or following an injury, and that makes a very stiff, painful shoulder. Pain predominates initially, and then you're left with just a stiff shoulder that won't do what you want it to. There are one or two things to rule out which can present in a similar way but have different treatments. But once it's established as a frozen shoulder, then typically it's initially a conservative treatment using painkillers, sometimes injections and physiotherapy. But in other people, it takes a long time to get better that way, and so surgery might be something we choose to go with.